We appreciate you joining us on the program. I'm Kimberly Bonatti, joined by Ethan Euchre.
Happy to be here.
Absolutely. And Jeff Wagstaff.
Hello, everyone.
Hello. And world-renowned orthopedic surgeon, Dr. Alfred Bonatti.
Hello.
Now, even with Congress's failure to officially repeal Obamacare, our healthcare system is desperately broken. And here to discuss is Harvard-trained medical doctor and veteran journalist, Dr. Elizabeth Rosenthal, author of the new book, An American Sickness, How Healthcare Became Big Business and How You Can Take It Back. Thank you for joining us, Dr. Rosenthal.
Thanks for having me.
Now, Doctor, a lot of your book details how we got into such dire straits here in this country with healthcare. So if you can, just give us a brief synopsis of how we got to where we are today.
Well, I think what happened is slowly over the last 25, 30 years, commercial consideration and business considerations have become the driving force of our healthcare.
The fact that healthcare is beyond what people can afford is unbelievable.
I think part of the problem is, the Affordable Care Act, that name was a bad brand. It did a lot of things that I think personally were important, but it didn't do very much of anything to make healthcare affordable.
Can you tell me something, though? Things like drugs, medical devices, surgery, and childbirth, they are much more expensive here in the United States than anywhere in the world. Why is that the case?
We just pay more for absolutely everything, whether it's drugs, hospital stays, devices, you name it. We pay a lot more, 2 to 3 times what's paid in other countries.
Is this because the American Medical Association started their coding system, and this is when it changed from patient care, true patient care, to money in the pockets of the American Medicine Association?
That's one factor, but that kind of transition happened in almost every part of medicine. Say in an emergency room, first the doctors, well, I worked in an emergency room when I was a physician. My work was just included in an ER fee. Okay. It was one fee, not that much. But then what happens is business consultants come into almost every part of healthcare and say, hey, you want to recoup more money for what you're doing? You want it to be more profitable? You could bill really differently for this and make a lot more money.
There's such a difference in training, though, between a medical doctor and a nurse practitioner or a physician's assistant, and we see the desensitizing of the public where they're starting to see them at the same level, and that's not the case. There's a big difference in education.
Doctors are angry about this, and I get that entirely because they work very hard to gain those skills. They are the workers in the system, the core workers. They prescribe, they refer, they diagnose, and yet they look at the layer of 20 administrators in their hospital who are all making $1 million plus a year, and they feel like they're undervalued.
I really think this is just a result of a total relaxed behavior of the physicians. We have the control of medicine. We have the control of the patients. We are practically, everybody talks about how million people are taken care by this insurer, 45 million by Aetna and things like that. We have the whole nation. We have no organization responsible to protect the doctor. If you protect the doctor, you protect the patient. The rest is just pure garbage. We can close the insurance companies, we can change the laws, we can manage the system, but we have no leadership. And unless we have leadership, we're not going to be able to do anything. Today, the physician is practically being the servant of a hospital or an insurance company. I see people totally submit their ethics and their responsibilities with the patient for an insurance company to say no to a colleague who's trying to deliver care. This is, to me, outrageous. It's insulting to my knowledge, it's insulting for my patient, and is detrimental the vision of a physician as a doctor representing healthcare. So I think we are doomed to disappear and become nurses because we are not protecting medicine and we're not protecting our patients.
Any closing thoughts on that, Dr. Rosenthal, because we're out of time?
I would like to see much more activism from physicians. You know, the AMA largely protects the business side of medicine now, not the physicians. And physicians went into medicine largely to treat patients. They didn't want to be activists. They didn't want to go to their administration and complain. But I think they really need to speak up where they work nationally, because I think patients and physicians have the same interests in this healthcare system.
Absolutely. Thank you so much, Harvard-trained medical doctor and veteran journalist, Dr. Elizabeth Rosenthal.
Thanks for having me.
Absolutely. Thank you.
Bye-bye.
Our healthcare system is very sick, and we need a doctor to treat it. Thank you for joining us on American Medicine Today.